Okay, Rahman, can you please introduce yourself to the audience?
Okay, my name is Rahman Abdul Latif. I'm staying in Taman Melawati for the last more than 20 years, and I'm working as a reminder, formerly working in the bank.
When did you first learn about your disease, and what did the doctors tell you that you needed to do?
I've been going on monitoring my engaged with University Hospital, actually University Hospital, for quite some time on monitoring my diabetic. You see, that during early, I think February 2009, doctor just looking for options, taking during one of the routine check, actually doctor found out there's a tumor at my liver, see? And after further checking, doctor confirmed it is liver cancer, that's stage 2, or they call it cirrhosis. And then from the blood DNA test, they show that the results show that there's a 43 million counts on, I don't know what they call it, but it showed that there's the virus, supposed to be 43 million count on virus of the cancerous virus in the at that particular, or in my blood. See.
So what did they propose that you needed to do?
Actually, because of that, the doctor proposed for operations, because they said it the tumor toward the end of the left part of my liver. See? So they say if there's no harm on the operating cutting it in that sense, because it didn't involve with other part, as we know that the liver can grow again. See? Only that I'm worried, since I'm a diabetic patient. I say that whether there is an alternative or not. See? And doctor said that it is at that time the particular hospital cannot provide the service because of the no surgeon available. But he said I have to go to somewhere else. See? And after some refer here and there, I actually went to this hospital Selayang, supposed to be one of the best hospital to treat liver cancer. And I went there. The first they did mention that it will take about at least 3 to 6 months, my turn to go for the operations. After seeking the appointment with the hospital, and then the next appointment came, I think the following day, and the doctor gave me an option. He said that if I want to, the following day, so the next day also I can do the operation. And then I get a shock of my life. See, rather than instead of waiting for 3 to 6 months, suddenly you said the following day I can do the operation. See? But I've been advised by Prof that actually I've been after the first appointment with Selayang Hospital, I've been referred or introduced for B17 treatment by Professor Putra. And then I did discuss with Prof. Then Prof said that why didn't you play with time? See? So because of that, I request to hold back the operation.
Tell us a story about how you got referred to Professor Sai.
Actually, I've been referred to Prof by my friends, because normally we send the children alternatively between taking in the morning, taking in the evening and sending in the morning. one of the day that I went to the hospital, Selayang Hospital, that I'm not around, that did actually the evening she informed me about the alternative. Instead of going for the operations, I can meet up this particular person, Professor Sat Putra, for treatment of the cancers without operations.
How did she find out about Professor?
She's told me actually during one of the TV Astro, I think Astro Awani session, she come across with the interview of the Prof.
So how did you feel when you were first diagnosed with cancer? You were telling us, the doctors were scurrying around.
Yeah, I think until now, when doctor found out, from my observations, doctor found out if it's not that easy to inform a patient that that they're having suffering a cancer, they're diagnosed with the cancers, you see. But it seemed it happened to me that it goes of quite some period of time after a few checking doctor. I think maybe they want to just confirm that it really what the diagnostic is right. You see? And but until I feel something wrong, then I ask doctor what it's all about. You see? And in fact, I did scold doctor. If it's urgent, we just have to tell me. Then after that, you find the solution. Don't tell the people think something that sort of like hiding or whatever it is.
So how did you feel when you were first diagnosed with this cancer?
One, because when the doctor said that I have cancers, but it's stage 2, I still feel, I feel shocked, but looking for alternatives. See. I know that I have to go for immediate treatment. See. And then only that didn't feel the option there when they go to the hospital, the conventional one, they're talking about operations, and but not the alternative is never mentioned by doctor or hospital. But I feel blessed and glad that I did come across an alternative medicines, and then the immediate, actually, although at earlier part is reluctant to take it, but I still feel that is the best alternative compared to the normal operation, surgery and chemotherapy.
So how did you feel when you first saw the 19-day protocol? The amount of medicine you had to consume. Were you shocked? Or?
Yeah, I did shock. Quite heavy with one box of bottles and of supplement. But I did after that refer to one of my pharmacy friends, and actually she also got shocked. He said, "Hey, this is all the good medicine. How you get it?" But I said, "I get it from the one person that is supposed to promise to all get it, that kind of to cure my cancer lah."
But you were already on supplements yourself, so were you taking those supplements? It was quite a normal thing.
Yeah, for me, taking a supplement is something that acceptable. See, supplement for the treatment for me is is an alternative. See. Only that because of the amount present that quite shocked me lah. See.
So how was the treatment for you for the 19 days? You started taking the medicine. How was the overall journey?
It did during the 90 days because I've been given the the schedule to follow from early in the morning till sleeping time at night. See, quite a journey of about more than 12 hours actually, and then apart from the schedule given for the 19 days, Prof also been advised what will be expected from that time frame of 19 days, and I'm going through with it lah, because and then I did plan what to do, that kind of thing. See, but the target is that I have to finish that within the stipulated period of time. See, and then they did inform if I took this, I will face with either I vomiting, I will purging because of the body taking in the detoxing process. Then if it happened, it did show that the body is reaction to the supplement in the good conditions lah. So, and it did happen to me only that for the last 10 days, for the last 15 days or 14 days, that is I'm going through process of there's purging. That's not every, but it's not there's something like that uncontrollable things. But it's at a certain period of time you feel that you have to discharge all that kind of things. It's controllable, manageable, that kind of thing. Only that the frequency is more than you will. We did feel uneasiness lah.
Was it difficult for you to undergo this treatment?
I think more easier than going for the operations. See, even the operation a few hours, then a few days you suffer in the hospital, that kind of things. But then this process actually within your manageable time frames.
What about the pantang larang food? Was it difficult for you?
That pantang larang is not something that difficult for me in the sense that I have been doing that for years already, just to monitor and control my diabetes. And then so with come another supplement, that kind of thing, process just cut short of things, easier identify. The main target is that to get the result as the targeted results after the 19 days process protocol.
So after the 19 days protocol, you waited for 5 days,
yeah.
Then you went and did your
we do it after the 19 days. We go for the blood test again and get the result. Then the Prof prescribed some of other additional supplement to fine-tune some of the figures of the thing. But generally, after the 19 days, show a good result.
So which blood test did you take? You took Prof's blood test, kan?
I took the Prof second blood test from LabLink for Prof referral, and then apart from that, I went to see the doctor because of the next appointment, and then I shared with the doctor that say that my whatever cancerous thing situations is show some improvement compared to the previous appointment. Then I asked for delaying the operation thing, see? Because anyway that time office quite busy also, so I just can leave the hospital for office for a long time, see? And the doctor, I said that you cannot delay this, see? But I said as far as the result of the blood LabLink blood test concern is show very great improvement from the previous one, see? With that, actually, I asked doctor the alternative. I bargained with doctor actually for alternative options. And then doctor recommend to go for the blood DNA test again. Although he said the result will take for some time lah. Yes, I took for the blood DNA option again, and when the result came out, the doctor told me that as far as the result of the blood DNA concerns, there are actually a lot of improvement from the previous one. When they first detected the blood DNA show is a 43 million count on the viral, maybe viral, that kind of thing. Then after that, this particular test result show is only 3,666 viral count or whatever it is, the cancer viral count on the blood.
This was after you gone through the 19 days?
Yes, after 19 days plus, kind of thing.
So maybe you want to say, after the 19-day protocol, my blood count reduced from 43
right.
to...
Yes. After going through the process of the 19 days protocol, my blood DNA test result show much very great improvement compared to the previous one. In fact, the second blood DNA test result is only showed as 3,666 viral count. So compared to the previous one is a 43 million count. It's almost like 99% improvement.
So would you recommend this 19-day protocol to any of your friends? And do you have any success stories that you'd like to share?
Yeah, I did recommend a few friends to see Prof to seek treatment or advice. And they are in improvement. There's a few friends. A lot of people actually worry that if you go for see Prof that you expected to take the 19 days protocol. But I've informed them actually you take the blood test first to at least you meet Prof, see the advice what is your problem, and then the 19 days is not a must if it's your condition, your sickness or whatever problem is not that serious. But you can still take the option, cheaper option of the protocol, the treatment, and it definitely will help your body conditions. But the most important thing that you have to follow all the pantang larang lah.
Is there any message that you have to send out to all the cancer sufferers out there?
I think basically don't hide. Actually, throughout my experience, people they are afraid or shy to share with general public or even to next of kin that to telling that they are suffering from cancer or they diagnosed with cancer. But if you didn't share or tell people that you got problems, you won't find the solutions. At least if we ask people or share people the options, a lot more people will find or found an option. Then it's not only a blessing for the patients, the people that suffer is also blessing to yourself, to ourselves. We sharing the something good for the world.
What is your view on alternative and conventional?
Actually, my option is seek both treatment. Seek both treatment. And our lifestyle, our body conditions might determine which one will be suit to us. And then for the conventional, might be you have to go for one block like that. But then for the alternative might be more on detecting earlier than your body conditions, and then you can practice the prevention instead of treating either during in the bad condition already.
So do you feel that combining alternative
Yes,
and conventional medicine is the way to go?
Because general public is they're afraid to know that they are the body, whether they are in the right sound, they're healthy or not. But I think we have to avoid that. You know that when normally in case of cancer, by the time people know that they have cancers, they are actually at the advanced stage, either stage 3, 4, even terminal. Then and that particular time you also been too short time of period for treatment, and then we also I think don't have enough money to treat that kind of thing. So, but if we take care of good health, then we are ready with certain careful and activity during the take care of body, then it should be more manageable.
So what you're saying is that do not be afraid to know
your body, your health conditions.
Because there is a solution.
Yeah.
Do not be afraid, right? Maybe you want to say that. That people shouldn't avoid going for medical checkup and not knowing their health when there is actually a solution.
Yeah, actually when people know that I go for the treatment, I got this, and people know that I suffering from cancers, and then people ask, how do you know? Really? Actually, I take the options that to get to know, to take care of my health. You see? So during one of the routine process that we found it actually is I consider it lucky because we found it during stage 2 instead of stage 4 or whatever it is. You see? And then you have a lot more time periods to find the solutions.
Did you do a lot of research on alternative medicine? Did you do a lot of reading?
Yeah, actually, after being diagnosed with cancer, then been introduced to Prof. I did a lot of readings, either surfing through the net or buying books, and to upgrade my knowledge on the cancer and alternative medicines and options. At least I can share with people to the basic of the preparing, or it's not preparing, that the basic knowledge of what to do next, that kind of things.
Did you feel that Prof's protocol was well explained to you before he did anything. He told you, hey, this is, were you convinced with his explanation?
Yes, in a sense, because Prof did explain in full what is your sickness like, what will happen next, and then he also explained if we take this particular supplement for the treatment, what will happen, and then actually we can check also the particular supplement that given for the treatment is something that can available in the market. Only that with the right prescriptions that we get the right treatment. Okay, I like to say, because if we take care of our health, then there's one quote that I was always do, either I see you or you see me. If it's by the time that you're diagnosed with the sickness that you see me, that means something is good. But if it's by the time your friend knows that you are sick, but I see you, that's it lah. I see you to the end of it. Yeah. I see you or you see me. I see you. Yeah. I see you. But you see me, that means bye bye.